Hi, I'm Ladine Lammers from the APH 162 anatomy course doing the pork heart dissection. And this is my pork heart. This is the exterior of the heart. It has 4 chambers. This is the right atrium, the left atrium, the right ventricle, and the left ventricle. And this would be the apex. This is the oblique groove where you can see blood vessels, arteries, and veins flowing. These are the 2 auricles that lay on top of the 2 atrium. The pulmonary trunk. This is the pulmonary trunk, which is to exit the right ventricle. The aorta, which is the tough elastic tissue with great strength for the blood that is leaving the left ventricle. The superior vena cava, which is right here, and if I put my finger through, you see the inferior vena cava. The superior vena cava, you can see, is purple and collapsed when it's empty, and while I stick my finger through it, that's when you can see where the inferior vena cava would be. The second entry into the atrium, the third entry where the blood enters, is the vessel on the posterior part of the heart, which is the coronary sinus. The coronary sinus, which brings the deoxygenated blood in from the heart itself. These are all used to transport the deoxygenated blood back to the heart. My first incision will be into the superior vena cava, which will enter into the right atrium. This will reveal the first heart chamber, and it will receive deoxygenated blood from the superior vena cava, inferior vena cava, and coronary sinus. I will open it up. As you look inside, you can see little, trying to find them, here, little pin pricks, holes along there. They're very tiny. Where the cardiac veins would come up to drain the blood into the coronary sinus and then fall directly into the right atrium. Another feature of the right atrium is the fossa ovalis, which means the oval depression. Its purpose is to convey blood to the fetus. Let's try to find this thing. It conveys blood to the fetus in the womb directly from the right atrium to the left atrium, bypassing the right ventricle, because the fetus would not be sending blood to the lungs while it's in the womb. So it's just a shortcut. This will scar over when the baby is born. You can see just a little bit in there. It's okay. If you look down through the right atrium to the right ventricle, you can see the valves that separate. Sorry, I just trying to find the, here, there's one. Cuspid. 2. 3. There is the tricuspid valve, which has 3 cusps. The valve cusp is thin and very strong. Attached to the cusp is the chordae tendineae, which is all of that stuff. These are string-like appearance. They prevent the inversion of the valve. The chordae tendineae are attached to capillary muscles, which lay inferior and anchor them to the ventricle wall. Now I will make an incision into the ventricle wall. And you can see the muscle, the myocardium muscle. It is used to contract to send blood to the lungs. Then you can run your finger along the intraventicular septum, which will enter the pulmonary trunk, where the deoxygenated blood runs to the lungs, through the pulmonary trunk, and then into the branches of the right and left pulmonary arteries going into the lungs. Right through there. And exits there. And then it would run like that into the lungs. I'll make an incision to the, to the pulmonary trunk. And you can see the pulmonary valve closes when the ventricle relaxes to prevent the backflow of blood as well. Which would be right. Just make a full incision through. Here's the 1, 2, 3 flaps of the pulmonary simular valve. And then there's 3, because they would go like that. Okay. Now I will enter the left part of the heart where the oxygenated blood is. The vessels that are at the top of the left atrium. Are often cut off too close to the organ. There would be the pulmonary veins from the right side and 2 from the left side. Let's see here. Okay. They're cut off so close that I can't even find exactly where to go here. Is it the right spot? Give it me. Okay, so this is the incision where they would have cut off where the pulmonary veins go. So it's kind of bigger because there would normally be a couple holes for them to enter. So I'm going to make an incision into the pulmonary vein, into the left atrium. See how thick it is already. It's a little bit more difficult to cut because of the thickness of the myocardium on the left side. The density is much greater than the right side. Okay. Through. And see the, put a little bit more here. See the valves here, the bicuspid valves. There's just 2 cups only on this side, which is still sufficient enough to cover the opening of the left atrium to the left ventricle. The density in the valves is also much greater as well. The thickness of that. Also, the papillary muscles are extremely dense as well, along with the chordae tendineae, which are thicker on this side. See them? They need to be like that to have enough, to extend up to enough pressure, which it has to endure. Another name for the bicuspid valve or the mitral valve. Its job is to prevent the backflow of blood into the left atrium. Continuing my incision into the left ventricle wall. You can see, look how thick that is compared to the other side. It's about 3 times the thickness of the right ventricle wall. This is needed to keep the muscle contraction strong enough, to have the blood pressure strong enough to push all the blood throughout the entire body. Following with my finger up the septal wall, it will exit into the vessel, the aorta, which is really thick and elasticy. When the left ventricle contracts, the aorta must stretch in order to accommodate the pressure of the blood that it's sending, the oxygenated blood that's sending out to the entire body. So I will continue my incision up the wall to the atrium, into the aorta. Ugh. And we'll take a look at the aorta semilunar valve, which is 3 flaps. This again is to prevent the backflow of blood. They're right here. One, two, three. And you can see there's these 2 openings right here and right here. Those are the right and left coronary arteries. They take the oxygenated blood to feed the wall of the heart. And that would be my dissection of the heart.